Now then, let's get more on today's announcement of the NHS workforce plan. Labour's Shadow Health Secretary Wes Streeting is here with me. Very good morning to you. I was talking to Steve Barclay, the Health Secretary, a short while ago, talking about this workforce plan. He said it was the most radical modernisation and reform of the workforce since the NHS was founded. The CEO of the NHS, Amanda Pritchard, has called it a truly historic day for the NHS. Do you agree with that?
Well, for the best part of a year now, I've been calling on the government to adopt Labour's workforce plan for the biggest expansion of NHS staff in history, doubling the number of medical school places, dramatically increasing nursing, midwifery, clinical training places. And I'm going to pore over the detail with a fine-tooth comb later today, but this looks remarkably like Labour's plan. So, having called on the government to do it, I'm actually relieved that we're in a position where recruitment will get underway, because we do have an understaffed NHS. I might gently point out, by the way, in terms of the historic comparisons, the last Labour government delivered 75,000 more nurses and 44,000 more doctors. It's crucial because while we need wider change and modernisation in the NHS to make it fit for the future, the NHS will always be a people-based service. And so long as we have a shortage of doctors, nurses, midwives and other crucial roles, we will have unacceptable waiting times, patients, I think, really frustrated with the NHS as much as they love the people who work in it. And you know, that's why we're in the situation we're in today, which is the longest waiting times and the lowest patient satisfaction ever on record in the NHS.
So you sound like you're pretty happy with the plan. You say that it was basically your idea. So do you give the government some credit for putting this into place? We hear Keir Starmer saying that Rishi Sunak is all about short-termism all the time, but he's really grabbed the nettle here, hasn't he? Do you give him credit for that?
I'll always give the Conservative government credit for listening to the Labour opposition. But there's a serious point, which is when you think about how long it takes to train doctors and nurses, 4 years for a nurse, 7 years for a doctor, it's really important that successive governments make the right decisions. And I don't mind admitting, like, looking ahead to the next general election and an incoming Labour government, potentially, if people vote for it, we are, as a team, deeply anxious about what the economy will look like, what our public services will look like. And we're looking at the numbers going in all the wrong direction at the moment, whether it's inflation, interest rates, NHS waiting lists. So to see the government taking a longer-term, correct decision, which we've been calling for, of course I would welcome that.
OK, and the fact that it's long-term gives security to the workforce, doesn't it?
Yeah, and I want to give that reassurance to the NHS as well. You know, we've got to make sure the numbers stack up. I'm not going to give a government a blank cheque here, but based on what I've read so far, and I spoke to Steve Barclay yesterday, I'll be questioning him on Monday in the House of Commons, and no doubt we'll talk in more detail as we would do. You know, I think it is important for me to say to the NHS that we want the biggest expansion of NHS staff in history. We want to give people the certainty. You know, for those, one of the reasons I announced our plan last year to double the number of medical school places is I want to give certainty to those vice-chancellors and NHS leaders so they can plan ahead. Yeah.
We'll stick to this plan.
So if the government is doing, as I expect they are going to do when the plan's announced, of doubling medical school places and a big expansion of training, I want to say directly to university vice-chancellors today, to NHS leaders, you can anticipate an incoming Labour government backing the biggest expansion of NHS workforce in history. So they've got that certainty for the years ahead.
And the government says that the report, the plan rather, is being backed by £2.4 billion of investment. That funding is only for 5 years until the next spending review, though. If you're in charge, will you go ahead with increased spending, and how will you pay for it?
Yeah, well, all of us make that commitment for a parliament. We said we'd fund ours by abolishing the non-dom tax status, because we think people who make their lives here and they're living here should pay their taxes here. That seems to be the one bit of our plan that the government haven't adopted. You can ask Rishi Sunak why he's not keen on abolishing the non-dom tax status. But that certainty, that stability for the longer term, I think is important. And you know, I think you've got to. One of the things I want to say to the NHS workforce, and particularly some of those junior doctors who are feeling pretty miserable about their futures, one of the things about serious workforce planning, you've got to get the recruitment going and more people into universities. You've also got to make sure that the pipeline carries through. So you get those junior doctors moving into consultant roles. So you make sure that the wide range of roles we're going to need for the future are going to be funded, and they're going to be there, and they will be with the Labour government.
But that funding is important, isn't it? But we hear all the time from the Shadow Chancellor, Rachel Reeves, that no spending will go through without her strict rules being in place. So are you going to get the money, or are you going to have battles with Rachel Reeves should you get into power?
Look, I'm glad the message has cut through, actually, with Rachel's discipline around the public finances. It's true that she runs a tight ship in the Labour Party because the public finances are an absolute bin fire at the moment. And there are things that, as Labour politicians, we would love to be able to do.
So with that discipline, how will you find the money?
Well, assuming the government's assuming the government's plan is funded in the way that I anticipate it will be, I'm going to look at the detail, that will be in the government's baseline, which actually, as an incoming government, would make our job a bit easier. But we've committed to abolishing the non-dom tax status. So we've got funding which is committed, and this, you're going to get bored of hearing this around the election. All of our policies are going to be fully costed and fully funded. That's the tight ship that Rachel's running. And we need to do that because I want people, especially when they're cynical about politics and politicians, I want people to know when they pick up our manifesto and they see our policies that these are things that we are certain we can deliver, certain we can afford. And a Labour government will under-promise and over-deliver, which is both important for the change we want to bring to our country, but also important for rebuilding trust in politics, which is in very, very short supply.
Can I get a quick thought on this introduction of more apprenticeships? Do you have any concerns about that? Do you think the unions might have something to say about this sort of a change to traditional roles in the NHS?
I think we've got to consult with the workforce. There's a huge amount of expertise there. But, you know, I grew up on a council estate. I'm a kid from a working class family. I think those routes into elite professions have been very powerful and can be even more powerful for widening participation and access to elite professions from a wider range of backgrounds. We've got to look at all of these routes. One of the reasons why I was a massive fan and a beneficiary of the last Labour government's commitment to expanding access to university education, because in previous decades, people like me wouldn't have got a look in. And my goodness, like, going to university has changed my life. I wouldn't be sat on the sofa talking to you without it. We've got to create more routes and pathways into elite professions. And I think we all have lived through the pandemic, and all of us, our lives have been touched or changed or even saved by the NHS. The possibility of opening the door to more homegrown talent for a wide range of roles in the NHS is something we should aspire to. It is the greatest institution this country has ever built, and I want more people to be able to work in it, to work for us, and to build an NHS that's fit for the future.
OK, Wes Streeting, thanks very much indeed for coming in this morning. Thank you.